Hi, my name is Dr. Kyle Hagel with Affinity Medical Group in New Hope, Minnesota, and I'm going to talk a little bit about kids and chiropractic today. Very often people ask, is it safe to adjust children, or should I get my child evaluated and checked out? I always recommend that children be evaluated. That doesn't mean that they're going to need chiropractic care, but it's very beneficial at least to know if they do have any spinal issues developing. Kids, when they start walking, they fall over. When they start to learn to ride bikes, they fall over. They play in the playground. They're very active. And the thing about kids is they don't really complain of pain. And spinal problems can result and be present for many years before they ever start to produce pain. It's similar to your teeth. If you wouldn't brush your teeth for a few days, they might feel kind of crummy, but they wouldn't necessarily hurt. In fact, it would take a long time for your teeth to actually hurt without brushing them. And by the time that your teeth actually hurt, you would have obviously developed some significant problems in your teeth. So it's important to get children evaluated in order to determine if they do have some type of spinal problem developing. The thing about chiropractic with kids is it's actually very safe. I adjust patients differently depending on their age and their size. Believe it or not, I've adjusted a child as young as 6 hours old. Children 8, 10 years old, 4 years old, 2 years old, it's very safe to adjust them. We just change a different technique, just like I adjust a 100-pound female differently than a 300-pound man. You just change and you lighten your adjusting technique for a child. It's very comfortable. It's not a painful thing for them. And the great thing about kids is they heal extremely quickly. They do not need nearly as many adjustments as we do as adults because their problems haven't been going on as long. As adults, we wait for those problems to become bigger issues, and then it takes longer to correct them. So it's safe for children to get adjusted. It's a very good idea to get them evaluated to determine if they need an adjustment. And it will not only help them with the problem now, but it will very likely, if they do have a problem, it will prevent a more serious problem in the future. So feel free to give our office a call, and we'd be happy to set up you and your child with a consultation. And I look forward to helping you both soon.